Are you suffering from sacroiliac joint pain and want to know if one of these belts can help you? How will you know if it can actually help? And also, how do you put it on properly to get the best results? And also, what else can you do with the belt? Can you exercise with it? And will it make your muscles weak if you keep wearing it? Stay tuned, I'm going to answer these questions for you right now. So the first question I'm going to answer is, does an SI joint belt help at all? Now, judging by probably the reviews that you've seen on Amazon.com when you look up these sorts of belts, the reviews can be all over the place. Now, the first thing that I find is the problem is that many people have been self-diagnosing with SI joint pain and they don't really understand whether or not they have that problem. Or, number two, they've been misdiagnosed with SI joint problems. So the first thing that would make this belt not work is not having a sacroiliac joint problem. But as you can see from some of the top reviewers, some people will put this belt on and they get immediate relief. So it works really, really well. So first of all, you have to understand that diagnosing sacroiliac joint problems is extremely complicated. It can't always be done simply from a postural assessment or a movement assessment, and even medical doctors have a lot of disagreement over the proper diagnosis of sacroiliac joint problems unless you have a major sprain or you've gotten into a car accident or had some kind of trauma with the SI joint. Now, I deal with mostly chronic problems in the body, so chronic SI joint problems are, again, very difficult to accurately assess. So the SI joint belt I find to be pretty useful. But the expectation of them also, I think, is another problem, is that if you put this thing on, you're going to get immediate and dramatic relief. Now, again, I said that some people, this will be the case, but more often than not, that is not the case. And when people wear this, they get some kind of minor improvement, which is really what the standard is and what I look for. If there's some improvement in with wearing the belt, then you should probably use it. Now, a good question is there any test that we can perform prior to purchasing the belt that will give us a good indication that the belt can actually give you some pain relief? Yes, there is. Now, there's a test that we can do in the supine position, that's laying on your back. Now, we have to keep in mind what this belt does. The belt, when properly placed, which I'm going to show you here very soon, is going to help assist with creating ligamentous tension in the pelvis, on the backside where the ligaments generally are loose and unstable. So, it compresses the pelvis. This compression motion increases stability. So we can mimic this without a belt, and it's a good test to do. So in this test, what you would do is you would lay on your back, and in this position, laying on your back, you would simply lift one leg approximately 30-40 degrees off of the table. Now, when you lift that leg 30 to 40 degrees off of the table, you're going to be assessing for how difficult it is to perform that motion, and if you get any discomfort in the sacroiliac joint region from doing that motion. So if either one of those is yes, positive sign, and we can use the sacroiliac joint belt to test whether or not we get an improvement. So we do that on both sides. The next thing we do is we put the SI joint belt on, and then we would test again. Now, in your case, if you haven't purchased your SI joint belt yet, or you want to know if it's going to help, what we would do is we would mimic the motion of that belt. So what I would do is place my hands on the side of the pelvic bones, on the iliac crest, and I would gently push in toward the front of the bones. And I would be putting a minor amount of pressure in there, maybe less than 5 pounds, to gently compress in. Now, as I hold that pressure compressing inward, the leg would be lifted again about 30 to 40 degrees off of the table, and if there's an improvement in the strength of the muscle, or there's less discomfort, or a combination of both, then it may mean that the SI joint belt is warranted. So this is an easy and simple test. It's done for assessing sacroiliac joint function, but it also gives us a great indication of whether or not this belt can be helpful. Now the next question is, how do you put this thing on? Well, there's a number of different kinds of belts out there, and you have to probably look at some of the reviews and see some of the pros and cons of each. I've used the Serola belt. I think this is fantastic. It's got a nice non-skid surface on the inside, and I think it's pretty comfortable. And the reviews are pretty good on this one, so I stick with it. It's a pretty simple setup. You've got a Velcro here in the front. That's it. And then you've got 2 small Velcros on the back side, and you can use these to tighten one side more than the other. It gets a little more complicated how to do that. or Y, and then we could also put tension on both sides at the same time. Okay, so there's a couple of different combinations for using this. The most important thing is where you place it and how much tension you have on it. So first of all, I'm going to tell you, you do not need to over tighten this thing. So in the research, it shows that very little is actually necessary to improve the stability in the sacroiliac joints. And many people, if they don't feel an immediate improvement, what they do is they really wrench this thing on, thinking that it's going to make it better, and that doesn't work. So there's only a little bit, and once you put it on and you have the appropriate tension in the right position, then the rest of it is the therapies that you need to do, such as your corrective exercises and anti-inflammatory work. So the proper positioning is this. If we look at our spine model, we have the bone on the front of the pelvis we call the ASIS, that bony protuberance. We have one on the back side called the PSIS, which is approximately the back side of the belt line. So there's that lip, or what we call the iliac crest, on the side of the pelvis. And then we have the hip bone. If we put our hand into the side of the hip, we can feel that right there. There's a space right in the middle, and that's where the belt needs to be positioned. Now, of course, this model is a little small, but it'll work for our purposes here. So the belt will need to be placed just underneath that ASIS bone and underneath the PSIS bone. So as you can see, when I put it around that section and it gets tighter, we're going to be compressing the sacroiliac joint region directly. A common mistake is for the belt to be placed too high, or once it's placed in the right position throughout the day or after sitting, the belt starts to scoot its way up and starts compressing on the lumbar spine. And this is not useful for us. It's not going to assist with the sacroiliac joint stability. So the proper location is directly underneath the ASIS bone and making sure that it's underneath the PSIS bone as well, so we get a nice compression right into the sacroiliac joint, and it improves the stability. And we can get the most out of using the sacroiliac joint belt. Another common question that's asked is, if I continue to wear this, are my muscles going to get weak? Well, the answer to that quickly is no, they're not. This is not the same thing as wearing, for example, a back brace, which is like a corset around the torso. When you wear a back brace or this corset, your body starts relying on the corset for stability instead of the muscles that are supposed to be doing that job. Now, the difference is the sacroiliac joints don't have any muscles that specifically move the joint. This is more of a ligamentous problem in the backside of the joint, and therefore when you use this brace, it increases the tension in those ligaments for stability. And this is not based on muscle issues. So therefore, wearing this brace, the sacroiliac joint belt, is not going to lead to muscle weakness. So frankly, you can wear this all day, every day if you want to, if it helps you. The last question is, what else can I do to help my sacroiliac joint problem? Well, first of all, the main priority is increasing stability. So a sacroiliac joint belt can help tremendously, as well as the most important thing in my opinion, which is restoring muscle imbalance problems and movement pattern imbalances. Now, these are the things where your body isn't moving correctly from your feet all the way up to your neck. If we have muscle imbalances, we're not transferring forces effectively away from the sacroiliac joints. And therefore, we're going to get more stress in that area. We're going to get more of the same problem, which we talk about the subluxation of the S3 segment in another video. You should definitely watch that one. And of course, we're going to get more inflammation, and we're just never going to break out of that cycle. We don't want to get to a point where you're relying on the sacroiliac joint belt because you can't stabilize your own body, because we keep creating problems with body alignment. So the other part of this is making sure that you're restoring muscle imbalance issues, you're correcting faulty movement programs, and you're getting the right exercises and the right stretches for your needs. This is critical to overcoming SI joint problems.